The outbreak of the coronavirus pandemic that saw many countries shut down and impose several restrictions on their citizens, including restrictions on movement and public gatherings, forced many people to embrace more the use of technology for interactions. This reduction in physical interaction meant that more people had in need of medical attention had to rely on telemedicine. Instead of going to the hospital to see a doctor, patients consulted them via video calls through various social media platforms. Though vaccines are now available for the COVID-19 virus, it is not uhuru yet. There is still the need to observe preventive measures, including reduction in physical contact. To this end, there is a push for more people to embrace digital health practices. Joining me via Zoom is the co-founder Royale Nursing Consults, Julie Mogbo. Good morning, Julie. Thank you for joining us on TVC Breakfast.
Thank you. Good morning, Veronica. It's nice to be here.
Right. When we're talking about digital health practices, what are we looking at?
Okay, we're looking at a situation whereby telecommunications and technology are used as an intervention to improve healthcare practices in Nigeria. There's been a lot of modifications when it comes to health tech, and as a result of that, there's a need for us to include it into our practices. So we're looking at a situation whereby we would have more people utilize digital health. We're looking at being able to share data seamlessly across different sectors. We're looking at all stakeholders coming in together to see how we can improve quality of life using technology and telecommunications. These are some of the things that we're looking at when it comes to digital health.
Help us understand how this will improve the quality of life, how it would improve healthcare services, basically, because you talked about improvement earlier.
Yes. So if you look at the current challenges we are facing with our terrestrial healthcare facilities, you would see that top on the list, we have long queues, especially with the ongoing, with the strike action by the doctors. There is this long queue of patients waiting to be attended to. That is one. Then two, we have cases that don't necessarily have to end up in the tertiary healthcare facilities, waiting on the queue to be seen by a doctor. Because of this huge or large traffic to the hospitals, the doctors have to spend lesser time with each patient. Now look at how complex the human being is. The person goes to the hospital to receive consultation and there's little time, not because the doctors don't want to attend to this patient, but you check there's a long queue, so they have little time to attend to a patient. This is one huge challenge the healthcare sector is currently facing. So if we bring in digital health, we are reducing that wait in the hospital because people will be able to consult with their physician from the comfort of their homes. There's another way that these services can be used is by establishing telemedicine booths, telemedicine hub, pod, or kiosks as they call it, where people can just walk to a particular telemedicine center, which has to be connected with an established hospital. They walk in there based on appointment, they are attended to. Then if need be, they would be referred to a hospital. So this is one of the ways that digital health can help in improving the healthcare services. Another way is monitoring health. So we have people who have a fear of going to the hospital. They don't want to hear about diagnosis and all that. One of the things that digital health is doing is to prevent diseases. It's to prevent diseases. So people can easily pick up their mobile devices, talk with a healthcare physician, share what their symptoms are or what their concerns are, then they receive health counsel. This way, we are able to even prevent diseases. But if there's a case where there's an established disease condition, they can easily talk to someone on the phone, a healthcare professional on the phone, or either via audio or via video. That way, their fears and anxiety will be allayed to some level. and they can be encouraged to visit a healthcare facility if need be.
So invariably, this will improve patients' experience.
Yes, definitely it will. Because sometimes the patients, they go to the hospitals with one mindset. I am going to get help. What they want to receive is help. They are oblivious. Some of them are ignorant of the challenges the healthcare workers are facing in their places of work. So if we have them begin to use digital health, then they'll be able to have that aspect taken care of. Rather than go to the hospital and you're wondering why you're on the queue, you're wondering why you're not called, you're wondering why someone who you saw came after you is being called up. All of this will be taken care of because you are going to fix your own appointment online. You have your physician attend to you online, so you won't have to deal with some of the patients face when they visit the hospital.
But as good as this sounds, what are the challenges you see? If as much as we need to embrace this, what are the challenges you see hampering this digitalization of healthcare?
Okay, thank you. The first challenge that I see here is the aspect of policies. So we have everyone practicing telemedicine. So you can pick up the phone and then call a doctor friend and all that. There are so many people coming up with web-based applications to be able to render these services to people. But if we do not have a guideline, if we don't have a framework that will guide the practices in Nigeria, then we are leaving room for malpractices. But thankfully, the government has taken the initiative. About 2 or 3 weeks ago, there was a stakeholders meeting on the operationalization of telemedicine kiosks in Nigeria. So that is in process. We're going to come up with guidelines. We're going to have policies put in place. That is the role the government is currently playing, and which is highly commendable. That is one. Another challenge is the perception, should I be talking to a device, why go physically to talk to a doctor? So awareness, sensitization, enlightenment is key. If the people do not understand digital health and that it has come to stay, we're going to have difficulties implementing it. So the government agencies, all stakeholders need to carry out that act of creating an awareness and enlightening the end users of the benefits that comes with utilizing digital healthcare practices. Then the other aspect is funding. So for instance, we were talking about establishing kiosks, telemedicine kiosks in different areas in the society or community. Who funds that? How much will the end users have to pay? These equipment don't come cheap. They're telemedical equipment that once a patient comes in, they come with accessories that you can obtain data from this patient, then share it with their physician, and the doctor can use the video means to attend to the patient. But who pays for these devices? So funding is a huge challenge. So these are the three. First, the aspect of guidelines and policies, which is already being taken care of by the government. Then the second part is the perception of the end users, and that requires everyone to come on board to create that awareness and enlightenment. Then the third part is the funding.
Funding being a major one here, but there's also the aspect of data, cybersecurity, and all of it, which has been a major concern, especially in this part of the world. We've seen even in countries that we feel that they have everything well put together, people keep hacking into their systems. Are we prepared to ensure that the safety of patients' data? Because a lot of people are talking about privacy as it is. Julie, can you hear me?
Yes, I can. I lost you a bit at some point.
Right. I was talking about the aspect of data management. We all know how we perform with regards to that in this part of the world. And then there's the aspect of cybersecurity, that in countries where we seem to have systems put in place to ensure the security of data and on all of it, we still see people keep hacking into systems like that. Are we prepared, or do we have measures in place to check all of this that I've mentioned?
That's a very valid point that you made, Veronica. That also was part of the critical areas of discussion during the stakeholders meeting. I was privileged to be in attendance. Our organization was invited, the telemedicine organization. So when we talk about data, yes, it's a serious issue when it comes to ensuring that our data is secured. And this, I think, is one of the reasons some people are skeptical or hesitant about embracing digital health. So measures are being put in place to ensure that our data is secured. We'll just do the best that can be done. That is why it's important that all stakeholders come in. So there's the issue of who owns the data, who controls the data. These were areas that were discussed at that meeting. So it's an ongoing work. So it's just for the people to understand that we are aware of the concerns around data security, and measures are being put in place. We have already those that are practicing telemedicine. We have different softwares that are being used where patients impute their data, and there's the medical records, there's the digital healthcare records as well. Regardless of the platform this data is imputed into, there has to be a central point where the data can be controlled. This is being worked on, and we're going to ensure that to the best of one's ability that our data is secured.
Right. Now, there's also the aspect of digital literacy on the part of patients. What happens to those who do not necessarily use phones that make use of data, those who live in rural areas who do not even understand all of this that we're speaking about, digitalization and all of it? What are the plans to, include them in this part of digitalizing the healthcare system, and that they are not left out, because issues that pertains to healthcare also affect them a great deal?
All right, thank you, Veronica. When we talk about the awareness, enlightenment about the use of digital healthcare devices, well, it's not only on the part of those in the remote areas. We also have to train the healthcare professionals. So we start with using these devices. So there are ongoing trainings, and the Society for Telemedicine and Digital Health in Nigeria, they are working on coming up with a curriculum to use to train the professionals so that they are also familiar with this. Then one of the things we did at that meeting, the stakeholders meeting, was to come up with the minimum standard of practicing telemedicine in Nigeria. What is the minimum standard? And the idea or the focus was to be able to reach the unreachable, go into the remote areas and have them access this. So one of the things we came up at that meeting was to see how either with their mobile phones, those that don't have the Androids or the phones, they can use the short code. There a possible way you receive text messages, can you just text and say what you're feeling at that particular time? So based on what they're imputing, they'll be getting responses. Now that's still for those who can read. So there are different measures that are being put in place. We can set up call centers where you can make a call and then you have people speaking different languages. It's a long walk. It's not something that can be all sorted out from the start. So as we begin to implement these practices, we're getting feedback from the community, from the end users, from the professionals, and they'll be made to do an ongoing modification of this entire process. Then another way is when we have these telemedicine kiosks or pods positioned in these remote areas, we have to send in professionals. So the professionals are there. Rather than have these people walk or travel to a primary healthcare center or to a tertiary institution, they can walk to these kiosks just within 10 minutes. That's why I said funding is a huge issue. They can walk to this point and you have a caregiver. One interesting thing about telemedicine, it is made in such a way that anybody can operate it. So you just have a guide from a remote doctor at a control center. So the doctor can tell the person using that equipment, do this, place the equipment here. What do you see? What do you hear? And all that. So there are even some devices that you have the regular medical stethoscope. Once you place it on the patient's chest, the remote doctor from wherever he is, anywhere in the world, can receive the sound. So we have devices like that. So it's an interesting practice and something that can work, but it may not start at that point. So we'll just make progress and modify as the needs arises.
All right. One other challenge that I would also like to point out is the access to internet service. Are we looking at collaborations in these areas that we feel there might be some challenge? Because it seems the federal government, with the things that we have enumerated, it seems the government cannot do it alone. Can you hear me, Julie?
Yeah. Yes, we agree. The government cannot do it alone. That's how. Yes, I can.
All right. Go ahead.
Yes, I can.
Yeah.
All right, thank you. So we quite understand that the government cannot do it alone. That's why we say it's something for all stakeholders. Now, stakeholders has to do with the government agencies, the NGOs, the private sector, then the patients themselves. They are also stakeholders in this whole thing, in this whole process. So we understand the challenges we have with internet connectivity. So, one of the things discussed was how we can utilize satellite. I think we have, is it the FMC in Katsina, we're able to pay a visit to that facility. They're already working on using satellite to be able to have seamless care, seamless sharing of data, receiving of data, uploading of information and all that. So measures are being looked into to see how we can have these practices seamlessly. There's the other option of storing and sharing. So where we have in a community where there's no internet services or connectivity, we can obtain this data, store it up, and then share. So like I said, at that meeting, we looked at the minimum standard to operate telemedicine. So whatever challenges that that is encountered in a particular community, we're already looking for measures to on how we can mitigate that, just to ensure that at the barest minimum, we can still provide healthcare services. So there's the part of using the satellite, and there's the part of storing and sharing data.
All right. One last question, Julie, before we let you go, is a critical aspect, and that has to do with if we have the required number of workforce that would drive this initiative. This is stemming from the number of doctors, healthcare practitioners that we see living the country in droves in recent times. Do we have the required workforce to drive this initiative?
Well, considering the brain drain, it's going to be quite challenging. And that is why we need every sector, especially those in the ICT, to also come on board. One good thing about telemedicine is, regardless of where our physicians are, with appointments, they can still consult. But then we will need the physical presence of healthcare workers at these different locations. So currently, it's going to be a challenge. It's going to be a challenge because we don't have enough manpower already in the hospitals. There were efforts by different facilities to practice mobile health, where they have vans to go into communities and take care of people. We had a lot of them come up last year during the pandemic. But then you already have your staff working in the hospitals. Who are those that would manage and run the mobile health program? So there's already that challenge. But like I said, with telemedicine, our physicians can consult from anywhere in the world. And for those who are buoyant, they can obtain these devices so that by themselves they can contact their physician anywhere. And then those in the remote area, we would have to train people. There will be need for training, giving basic healthcare training to interested individuals so they can be deployed to this community, how they connect with a professor during consultations.
All right, and that'll be a fine place to leave the conversation. Our co-founder, Royale Nursing Consults, Julie Mogbo, thank you for your time on the Breakfast Show.
Thank you, Veronica.